Hey everybody, welcome to the AI Guide where we're making AI human. I'm David. Thanks so much for tuning in. I really appreciate it. Follow us on Facebook, Instagram, and Twitter also. And click those links below. Get my book on Amazon, The Beginner's Guide to AI, Short History of AI and Current Impact on 10 Different Industries. It's a fast read, a couple of hours for the whole book, and will give you a very nice broad look at how AI is impacting many different industries. And the other link, free resources. The resources are free. Everything in the resources is free. And you're going to learn much more about AI than we can do in these short segments. So be sure to click those links below. And thanks again for tuning in. So today we have a great article out of the Wall Street Journal titled, "The AI Will See You Now," and it's by two doctors, Lee Hood and Nathan Price. Now we're going to change a little bit of what they say in here because since we focus exclusively on AI, we're a little more current in some things than these doctors are, but it's an excellent article, and it really breaks down where AI is with regard to healthcare right now. So let's get started. Even the greatest of human brains can't remember or interpret even a tiny fraction of the information now available on human health and disease. This is a massive change from not long ago. Just a few years ago, and they mean it, just a few years ago, say 2019, most medical decisions were based entirely on the knowledge in the head of the doctor at the time the decision was made. Today, that is beginning to change thanks to the rapid development of AI. AI is one of the most quickly adopted technologies in history, promising profound changes for the way we live and work. That's why I started the AI Guide, to prepare you for the most exponential, the most rapidly being implemented technology in the history of mankind. Some of the most important changes will take place in the field of healthcare. As the technology behind these systems progresses, AI will soon be as much a part of our healthcare experience as doctors, nurses, waiting rooms, and pharmacies. In fact, it won't be long before AI has mostly replaced or redefined all of these. So this is two doctors telling you exactly what I've been telling you, that this is going to be massively disruptive and you need to prepare yourself for this. Save money now, early in your career. So they go on to talk about AI decision support systems because they're good at storing, recalling, and correlating vast amounts of information instantaneously, which humans have a limit on, obviously. When early so-called expert systems were first being developed in the 1980s and 90s, they were met with hostility by many physicians, and we've talked in the history section at the beginning of this channel about expert systems, but the very, very early efforts at AI were first neural nets, believe it or not, that didn't work because there wasn't enough computing power and games like chess. But then it moved into expert systems. Research has shown that these systems have gotten better at helping doctors spot potential outcomes they may have missed. And they mentioned something that they call centaur doctors, combining the best parts of human intelligence and AI assistance. Medical mistakes account for about 250,000 deaths a year in the US alone. That, when I read that, that was stunning. 250,000 people die every year in this country only due to medical mistakes. So AI becoming more powerful and making its way into the healthcare system is good for the consumer. AI-enabled healthcare already has saved countless lives. Like I've always said, AI is both good and bad. An AI program called MedAware, for example, helps doctors avoid accidentally prescribing the wrong medicine. And they give a story about a doctor who checked the wrong box in a list of medicines and killed a 9-year-old kid. 70% of medication errors are the result of adverse effects caused by prescription errors, meaning the doctor wrote the wrong prescription. 70% of the time these errors occur. There's a reason for this. The FDA has approved tens of thousands of prescription drug products, many of which have very similar names. A simple misspelling or temporary lapse in memory can deliver the wrong medication to a patient because of this vast number of medications. The system also signals doctors if they attempt to prescribe a medication that could interact negatively with one of the patient's existing medications. Another common error that is almost never checked by physicians, however, it's supposed to be checked by pharmacists. That's one of their main jobs. The risk of making mistakes often keeps doctors from thinking creatively. They're afraid of getting sued. One of the biggest costs for a doctor of all, if not the biggest cost, is medical malpractice insurance. So doctors therefore restrict their options to a small number of familiar treatments for a given condition. With the combined power of AI and individual data clouds, we can do much better than following the average patient. So individual data cloud, all of your health records throughout your entire life following you around digitally. Clinical decision support systems also help make test results more personalized, adjusting test ranges for age, sex, ethnicity, disease subtypes, and so forth. One of these is called DXplain. DXplain helped family medicine residents score significantly better on a diagnosis test involving 30 clinical cases, improving their accuracy rate from 74 to 84%. That may not sound like much, but 10% of 1 million people is 100,000 patients accurately diagnosed as opposed to misdiagnosed. That's a huge difference, huge. AI models can combine multiple data sources, including imaging, blood markers, and genetics to gain higher accuracy rates without having to do invasive procedures like biopsies. A study showed that urinary bladder tumor analysis can be performed by AI at an accuracy rate of 93%, better than a human being. They're talking about how tumors are graded in severity. Though there is still some resistance, those who fold these systems into their practices will be doing their patients and themselves a great service. It's like having thousands of experts at your disposal working at top speed. The potential for optimizing care and making it radically cheaper is striking. Advances in medical AI are owed in large part to the increasing amount of data at our disposal and increased computing power. By feeding data from patients into a deep knowledge system, that's deep learning system, for analysis and interpretation, doctors can derive leading-edge diagnostic and therapeutic approaches uniquely targeted to the individual. That's what's coming. Personalized medicine, personalized to you as an individual. Unlike computers, humans are quite good at recognizing when rules should not be applied to a particular case or where logic breaks down. That's why we need deep reasoning as well as deep learning. So deep learning models are getting more and more common. Deep reasoning, there's a wholly different word for that, and it's called unsupervised learning. So they talk in this article like that really isn't going yet, but my viewers on this channel know that unsupervised learning is growing exponentially at this point. Such systems that both have vast data and this reasoning functioning are essential in order for doctors to function in a world of unimaginable data, medical understanding, and insights. AI will offer a selection of proposed decisions explained in terms that physicians can understand. Then, one of the most important things in the article is this: AI will become a powerful teaching tool as well as a powerful tool for dispensing health. And we've talked repeatedly on this channel about how AI is going to revolutionize learning, which it is. It will personalize learning just the way that medicine is becoming personalized. Humans and computers will be able to engage in sophisticated, reasoned discussions about a patient in the near future. Deep reasoning, unsupervised self-learning, will in time begin to identify connections and concepts that humans simply cannot see or understand without the help of AI. Will solutions be incorporated even if we humans cannot explain why they work? However, for example, we know that many pharmaceutical remedies work without understanding exactly how they work. It has always been this way. Even though modern drug aspirin is 165 years old now, the mechanisms underlying its effect on the human body are still being studied today. We will use it because it works, even if we don't fully understand it. So there you go. AI, I'm going to say within 2 years, especially at hospitals and big medical practices, AI will be an integral part of your experience at the doctor's office. Thanks so much for tuning in. Click those links, and we'll see you next week. Take care. Have a great rest of the week and weekend. Bye.